In terms of boosting immunity, immune enhancement therapy has been a forerunner of advanced wellness therapy. So I know that involves NK cell, which is also called natural killer cell. Well, Dr. Rajbans, may I know more about NK cell?
NK cells are basically not new therapies that have been just around, I think, the last 2-3 years. And these are all therapies that we are using to boost our immune system. But before that, we must understand we actually have got a very powerful immune system, right? We got a lot of cells that, the B cells, the lymphocytes, the macrophages that actually help us fight against all infections, viruses, bacteria, and also against cancer. Right, and out of this, there's one called the NK cells or the natural killer cells. It's a lymphocyte, and this actually gets rid of two things. One is it gets rid of viruses, cells that are infected with virus. Not only does it destroy the cell, it also kills the virus. And number two, it gets rid of any cancer that's formed in our body. Right? In fact, most of the research was more of NK cells and cancer. Because any cancer is also a big problem. But now they also realize that NK cells can actually also get rid of viruses. So this is new therapies that we're using to basically boost up our immune system, to help us fight against viruses and cancer.
I see. So who would you recommend to do immune enhancement therapy?
Right. I mean, if you're looking at anyone who's got low immunity, and nowadays I can actually put a lot of people in the category. People with chronic diseases, who have diabetes, hypertension, kidney disease, people with cancer, people with, who are older. And I mean, from our COVID pandemic, we've realized this, that people with chronic diseases, elderly people with low immunity, and these are the people who actually succumb to these infections, right? So these are the people who actually will actually benefit a lot, not only to help build up the immunity against viruses, but also to prevent cancer, because cancer is another problem when your immune system is weak. And today I think a lot of people will fit into that category, right? So if you want to have a healthy lifestyle, live long, live well, stay healthy, I think this is one of the the things that you have that can help you boost against viruses and cancer.
I see. So in terms of process of immune enhancement therapy, what am I looking to do?
Basically what we do is, it's autologous in the sense that we use your own blood. We take about 50 ml of your own blood and we send to the lab where they actually culture these these NK cells, and it takes about 2 weeks process. It takes 2 weeks for them to culture to increase the number of cells in your body. What you probably realize is that your number of your NK cells are probably low, right? So what the lab will do is increase it to a number that's a billion or more, that will then be taken and transfused back into you, right? Now, being your own blood, autologous, there's no chance of rejection. So what you have is an increased number of NK cells circulating in your body that now will help you fight if there's any virus inside or any cancer cells are formed, they'll get rid of them.
I see. Well, after receiving NK cell infusion, what can I expect to see short term and long term?
Right, I mean, you might not see any difference as such, because it's not something that's going to make you like suddenly, get more stronger or whatever. But what you'll find is that your chances of getting infections are low. But it's more the hope that these cells will get rid of any cancer in your body, and if there's any infection, and then your body can now help to regrow itself and help to make the rest of the immune system stronger. So over time, your risk of infections might get lower, and also hopefully if there's any risk of cancer, that will also be much lower.
I see. What type of people would you not recommend for this therapy?
I mean, anyone who has got current cancer, that means he's going on treatment for cancer, he's having cancer, he should get that treated first, right? If somebody who has got very uncontrolled diabetes or blood pressure, they must control that. They can't take, they must control that before we give them the therapy. But cancer, we want them to get it treated first. We will not use NK cells for someone who's already got cancer.
So who would be the perfect candidate for immune enhancement therapy?
So again, anyone with poor immunity, and if they get recurrent infections, they're worried that their immune system is low, they can actually benefit from this.
I see. Well, thank you, Dr. Rajbans,
Thank you
for the valuable insight on immune enhancement therapy. I believe you all benefit from his sharing. Thank you very much.